All right, dentists, let me paint you a picture. You've just completed what you consider a technically flawless procedure. The margins are perfect, the occlusion is spot on, clinically it's a home run. You're feeling pretty good. But later you hear that the patient felt rushed, confused about the post-op instructions, and that the front desk person was a bit rude. Or maybe they leave a lukewarm or even negative online review that seems completely disconnected from the excellent clinical work that you provided. What happened? The disconnect lies in a fundamental truth many of us in the dental profession can sometimes overlook. Patient perception is their reality, not your clinical reality, not what you think their experience should have been, but what they actually perceived it to be. And that perception, my friends, is everything. Today, we're going to tackle this concept head on. We're exploring why it's absolutely essential to step outside our clinical mindset and actively work to see our practices, our communication, and our care through the eyes of our patients. Understanding and intentionally shaping patient perception is a cornerstone of building a thriving, profitable, and ultimately a more enjoyable dental practice. When you master this, you'll see happier patients, glowing reviews, increased case acceptance, less stress for you and your team, and a practice that truly feels rewarding. Let's first be honest about why this perception gap often exists. As dentists, we're trained to focus on the clinical, the technical. We're thinking about microns, anatomical landmarks, or material science. And that's essential for great outcomes, but our patients, they're operating from a completely different perspective. They're often coming in with some level of anxiety or fear. They're thinking about pain. Will it hurt? They're thinking about cost and time. Can I afford this? How long will I be here? They're thinking about aesthetics, but often from their own subjective viewpoint, not necessarily our clinical ideal. They're wondering if they'll be heard, if their concerns will be dismissed, if they'll feel like a number or a person. We understand the intricacies of dentistry so well that we often forget what it's like not to know these things. We might use jargon that's completely normal to us, but completely foreign to a patient. We're busy, focused on the task at hand, while they might be feeling very vulnerable and often overwhelmed. Let's look at some common areas where our reality and our patient's perceived reality can differ significantly. Wait time. You might think, okay, I'm running 15 minutes behind today. It happens in a busy practice. We'll catch up. The patient perceives my time clearly isn't respected here. This office is disorganized. I'm getting more anxious just sitting here waiting. Then there is explaining treatment. You might think I thoroughly explained the mechanics of why this crown is necessary. And the patient perceives the doctor uses a lot of big words and I didn't understand. I'm still not totally sure why I need this expensive thing. I felt a bit intimidated to ask more questions. For pain management, you might think the local anesthetic is great, but there should be very little discomfort. It's not a big deal. The patient perceives that injection really hurt. I was tense the whole time expecting pain. The doctor didn't really check in to see how I was doing. Then there's the office environment. You might think the operatories are functional and they meet all the clinical standards, but the patient perceives this place feels a bit dated and sterile. The lighting is harsh. It doesn't feel very welcoming. Now, if a patient's perception is negative, even if your clinical work was flawless, what's the fallout? And it can be significant. There's poor online reviews, negative word of mouth. That can also just cripple your new patient flow. Reduced case acceptance is a big one. If patients don't trust you, if they feel confused, or perceive a lack of care, they are far less likely to say yes to your recommended treatment. You'll likely see an increase in patient complaints and overall anxiety levels, which then translate to increased stress and burnout for your entire team. Ultimately, a practice where patient perception is consistently poor will struggle to grow and thrive. So how do we bridge this gap? How do we actively cultivate the skill of seeing our practice through our patient's eyes? Here are 4 great ways to start. First, actively cultivate empathy. This is essential. It means consciously making an effort to imagine what the patient is feeling at each stage of their interaction with your practice. What are their likely fears, concerns, or hopes? This is about understanding their perspective so you can meet their needs more effectively. Train your entire team in this empathetic approach. When empathy guides your interactions, patients feel understood and valued, which is a massive component of positive perception. Second, conduct an audit as if you were looking through the patient's eyes. This is incredibly revealing. Set aside time to experience your practice not as the owner, but as a brand new, slightly nervous patient. Start from researching your practice online, to calling for an appointment, to finding your office and parking, and walking in. What's the first visual impression? What do you see, hear, and smell in the reception area? Sit in your waiting room chairs. Then walk the path to the operatory. Sit in the dental chair. What's your vantage point? How does it feel? Go through every step right up to the checkout. Take meticulous notes on everything that could be improved from a patient's sensory and emotional standpoint. You'll be amazed at what you discover. Third, master clear communication and proactively manage expectations. This is where so many practices stumble. Ditch the dental jargon. Use simple, clear language that anyone can understand. Analogies work wonders. Focus on the benefits of treatment to the patient and not just the clinical features. For example, instead of saying you need a crown, explain why in terms they understand, like this tooth needs a strong helmet to protect it so you can keep chewing on it comfortably for many years to come. Always check for understanding and create a safe place for questions. Equally important is managing expectations. If you're running late, tell them. Explain post-op risk clearly and discomfort clearly. Be transparent about financials before treatment. No surprises. Surprises are almost always perceived negatively. And then fourth, relentlessly solicit feedback and empower your team to act. You cannot truly know their perception if you don't ask, and then also listen. Implement simple, consistent ways to gather patient feedback. Anonymous post-appointment surveys asking what's one thing we did well and what's one thing we could improve. That can provide amazing information. Encourage your team to have brief, genuine check-in conversations like, how was everything doing for you today? And critically, when they receive feedback, act on it. Show patients their voice matters. Train and empower your team to be your eyes and ears and to spot subtle signs of patient discomfort or confusion, and to address these issues proactively and compassionately. They are your frontline patient perception managers. When you consistently focus on seeing your practice through your patient's eyes and on improving their perceived reality, the benefits are massive. You build deeper trust and rapport, patient loyalty skyrockets, you'll see more positive online reviews, and a significant increase in word-of-mouth referrals from happy patients. Case acceptance will naturally improve because patients who feel understood, cared for, and respected are far more likely to trust your recommendations. Your own stress levels and those of your team will decrease because you're dealing with fewer misunderstandings and unhappy patients. And ultimately, your practice becomes a more positive, fulfilling, and profitable place to be. So my challenge for you is this. For the next week, make a conscious effort in every patient interaction to pause and ask yourself, what is this patient likely perceiving right now? How can I make this experience better from their point of view? Focus on implementing these 4 strategies. Now let's keep working together to make dentistry fun, fulfilling, and rewarding. Subscribe so you don't miss the next strategy, and I'll see you soon.